Today we're here with Dr. Eddie Irions from the Charleston Gastroenterology Specialists and Charleston Endoscopy Center. Dr. Irions, thank you so much for joining us today.
My pleasure.
Now you're here to talk to us about, I'm going to try and say this right, gastroesophageal reflux disease.
Perfect.
Now that's what a lot of people have heard referred to as GERD.
Yes.
Can you tell us exactly what is GERD?
Well, GERD, quite honestly, is heartburn that surfaces frequently. If someone has heartburn frequently, and when I say frequent, I mean more than once per week, that is considered gastroesophageal reflux disease until determined otherwise.
Okay. Now, how does someone get GERD?
Well, GERD, as you know, can happen to anyone. Arguably, all of us have had these symptoms, but it's the frequency that brings about concern. And GERD often is coupled with abdominal pain, early satiety, abdominal discomfort, and sometimes even unintentional weight loss. If any of these symptoms surface along with reflux disease, it may very well warrant a more extensive workup.
Okay. Now, Dr. Irions, a lot of us lay people, if we feel that if we have something like GERD, we just may go to the local drugstore and get an over-the-counter remedy. Is that something that you would recommend, or is this something that needs a prescription?
No, there are many over-the-counter medications that are very helpful with managing GERD symptoms. But it's when GERD, again, surfaces very frequently that perhaps more investigation should take place.
Okay.
Yes.
Now, when do I know I need to come in and get evaluated?
Again, frequency, I think, is the most important entity of this. If you're having abdominal discomfort along with nausea, vomiting, any of those things, along with just regular heartburn, and also heartburn that surfaces more than once per week, it might warrant additional testing, looking for a bacteria called H. pylori, or even an upper endoscopy that allows us not only to look at the esophagus, but also the stomach and the small bowel.
Okay, great. Well, Dr. Irions, thank you so much for giving us that information today.
Yes.
If you'd like more information on GERD, you can contact Dr. Irions at 722-8000 or log on to charlestongi.com.